PostAbortalCare pack, a care given to a woman who has just had a miscarriage. So this entails removing the remaining product of conception so that the uterus can contract and stop bleeding. So pack must, just to summarize it, is just care given to a woman that has had a miscarriage. So most cases everything is complete, the miscarriage is complete, and in some other cases is incomplete. And when it's incomplete, it means that there is product of conception remaining inside, and these products, when left in, they are not good. They can cause first bleeding, uterus will not contract, and so the vessels will keep bleeding, and when left there, sepsis, because of course those things are not supposed to be there. For you know, bacteria starts feeding on them and start multiplying and can result to sepsis. Okay, and when it gets into the blood, septicemia and to death. So this is an NVA pack that I want to talk about today, the parts of the NVA pack. So I want to show you how to fix it. Okay, this is the first. This envelopes this one. Like this, you have to ensure that it's perfectly sitting inside it. Then press it into cover. This is the cap. Put it in the cap and then press it in. Okay, this is the head. Okay, the plunger and the barrel. Now there's an O-ring here. This black thing, it's called an O-ring. Can remove it by pressing this like this, like you want to press it together. It will give a little bit gap where you can pull it down from. Pull it down. I don't want to pull it down entirely. So when you do, you can always lubricate this ring so that it will make your work easy, because if you don't, I've seen firsthand how wicked this can be to you. So this goes in here and look at it. It's already showing the wickedness. See, that oil helps to lubricate this. So I have to do this video now, and there's no time for me to go and get an oil. So this is it, but because there's no oil, it's still going to give us issues. So here it is, and so this goes in here. Ensure you check where these are supposed to be, make sure they are aligned. Now, to create a vacuum, how to create a vacuum? You press this down and forward, down and then forward, the two of them. If you miss any one, it won't allow you to walk. Down and forward. Now the two of them are pointing at an angle, so this way you can create a vacuum. I'm missing something here. Let me find it. Okay, like it's in the other container, and I wouldn't want to go and touch the container. I don't want to open it. So that's just something like this in the picture. That's what goes in here. just to hold this thing so that it doesn't come off entirely. Now we've pressed this thing down and forward. We want to create a vacuum. You pull. Okay, we don't have that. I don't want to go. So you pull it here with these two hands. Now remember, I mentioned about lubrication. It's making it difficult. So now it's out. You put your these hands come out to hold it. Now there's a vacuum. There's a space here, and not just a space. There's a vacuum there. When you release it, you will hear that sound. This is created so that when you attach something that is supposed to go into the uterus, it can be able to suck out the returned product of conception. So now you hear the sound. That is the sound that shows you that your vacuum is perfect. Okay, now these are cannulas. They go into the uterus depending on how dilated the cervix is. There are different sizes, color coded, and they have their number. This is 5, 6, 7. Okay, this is 4 here. This is 4. Look at it. Where is it written? Don't know if you can see it. Yeah, this is 4. And this is also 7. This is 12. Look at it. 1, 2, 12. And another 6. So some big ones. This size 10. Size 10. Size 12. And size 9. So when a vacuum, just create a vacuum again, press down and forward. Ensure you do the 2 of them at the same time. If you don't get it right, ensure you do it again, down and forward. You have issues if some of these instruments are not the way they're supposed to be, but ensure you get it. Then you pull. See, without that ring here to hold it, you can pull and go all the way, but even the ring is here, it will prevent it from coming out entirely. Now let's try this again. I'll try to be gentle and slower, kind of, so that it doesn't come off. Okay, I succeeded this time. Then this goes into the uterus through the cervix. Through the cervix, it goes in like this, sits in the uterus, while this is attached, not pushed. This stays here while this one comes back in. You don't push it so that you don't perforate the uterus. So this comes back to attach here, and by the time you release this, I'm going to dip it inside the solution so that we'll see the sucking action. So I'm going to be releasing. Okay, I hope the lights allowed us to see that. So that is it. Okay. To wash it the same way, you have to open everything so that you don't miss anything. And when you open, you don't bring out the O-ring, you bring it down so that it can be here, else it might get lost.